everybody, and I'm really excited. This is the best part of my day. This is a continuation of a series that we've been running over the last 4 or 5 years at Northwestern and a little bit at U of I, and it is really. I graduated public health school in 1970. And it is the course I wanted to have in public health school, but never had. So it took me a while to come back to get it, but eventually. So patience and irony are the qualities of a good public health person. What the other thing that I hope to get out of this session is, first of all, from the point of view of I will be interviewing Shweta about her background, why she made decisions she made, how did she get into this area, what were the pros and cons, what frustrates her and what excites her, etc. And I hope she will talk a little about all of that history today, where she was born, family, etc., etc. And then also the ulterior motive is for the students for her to describe to some degree what she's been doing over the past 10, 15 years. And this is because most global health stuff here, Northwestern, and actually all of the programs I see in the US are focused on, very appropriately, on people going somewhere, providing a service or teaching there, and being local community oriented with their public health initiatives and interventions. And I applaud that, but there's another area, and that is global public health policy. And in this case, global public health, environmental public health policy. And it is a much more ethereal situation without a global government. So I hope we will be able to get into, as Shweta describes what she's doing, some of the more granularities of what you do in that area, and as a role model for graduate students. And I will say something now, and I will not say it again, but nobody ever believes me. You can begin to contribute on this global level now. It turns out, I wouldn't have believed it before we started doing it, but it turns out, especially with our electronics today, that your input as students and young professionals is desired, wanted, sought after, and you can literally become involved in this as you move ahead. And you don't have to wait till you're chairman of some department or whatever. And in fact, it's best if you don't, but that's another question. So that's all I'm going to say in terms of advertisement or whatever. And let's begin. Shweta, where were you born? What kind of a family you're coming out of? What did your parents do? That sort of thing. Set the scene for us. For anybody who doesn't realize it, Shweta is situated in India, in Kerala, and hopefully she'll talk a little about the politics of Kerala, because I think that's fascinating. I give it to you.
Thank you, Peter.
I didn't even give you the formal, but it was on the notice of the meeting and everything. But tell us your current, tell us your current position with respect to this global activity.
Okay, thank you, Peter. And good morning, I think. Good morning, everyone. It's almost late in the night here. My name is Shweta Narayan, and I'm the climate and health campaigner for in the global team for Healthcare Without Harm. And basically, my current position, I work with health professionals around the world, mobilizing them, and them sort of becoming advocates for climate action and health initiatives in their local, regional, national, and global spaces. So mobilizing health professionals around the world is something that is sort of one of the key pieces of work that I do. And apart from that, one of my other parts of my, another part of my work is to sort of bring in the health connection or the health impacts of climate change into a larger conversation with environmental justice, climate justice movements. Because as we see around right now, health is not at the forefront of all these conversations. There are many, many issues and many, many aspects of movements different groups are sort of taking. And our vision is that if we want a healthier future, healthier planet, and if we want meaningful climate action, health has to be in the front and center of all decision makings. And how do we make that happen with groups, diverse groups and communities around the world is the challenge that sort of we're trying to tackle and mobilize around that. So that's a little bit about my current work. And I have been in this position for last 7 months only. So I'm also learning and growing as this position, as I'm sort of understanding the dynamics around. I'm trained as a social worker. I'm a professional social worker, and my specialization when I was studying was criminology and correctional administrations. And I have worked extensively as a student social worker with the prison systems, with the police, and especially in Bombay, where I trained with the anti-narcotic cell. So that's my sort of training and background. I got into environment and environmental justice because as part of my master's thesis, so I was doing my master's in social work in the year 2000, 2002. And in the year 2000, the Supreme Court of India had passed a landmark judgment on air pollution. And air pollution has been in topic for the last 10, 12 years in India, especially. Delhi air pollution makes global news. And according to World Health Organization, 15 of the top 20 polluted cities in the world are in India. And this is a problem not just in the last 2 decades. This is a problem that has been there for a very long time. So when I'm talking about 20 years ago, in the year 2000, Delhi Supreme Court of India had passed a judgment on cleaning Delhi's air by relocating all the small-scale plastic recycling units from the center of Delhi, which was a sort of a workers' hub, to outskirts of the Delhi. It was just basically shifting the polluting units from one place to another rather than solving the problem of air pollution. And that caused a huge social disruption, especially for the working class. And that's how I got into environmental issues, and especially looking at environmental crimes, because I was trying to understand the politics of environmentalism and the working class environmentalism, and how it sort of interfaces in the everyday life, and especially when you are tackling issues of judiciary and who makes the decision and for whom. And there were a lot of, I was doing a master's thesis, there were a lot of questions that I was trying to tackle. But one thing that definitely came out of this whole process was my interest in environmental justice work, and which I sort of continued. And just to take a step back, and I will talk about that more, but just a little bit of my background. And I just feel that my background and where I grew up also played a huge part in my decision, I think subconsciously. So I grew up I was born in Eastern India. Now I live in South India. And I grew up in an industrial township. And this is a steel hub. In fact, this city is called Bokaro Steel City. And this was the first steel plant that India had set up in collaboration with the Russians. So it was this city was set up in 1968. I was born in 1979, and I think from 1980 onwards, my father was an engineer in the plant. We moved there, and I did my schooling in Bokaro. I grew up literally there, and then I moved to do my college and higher education. And Bokaro Steel Plant is in eastern state of Jharkhand now. It's a mineral-rich state. It's predominantly indigenous population, and so the lot of forests, a lot of water bodies. But this is because of mineral-rich nature of this area. There are a lot of mines and mineral-based industries. So coal mines, power plants, hydropower. I mean, these are like very, very regular feature in the landscape around that you see. So I have grown up from 50 kilometers from some of the dirtiest and largest coal mines in Asia in Dhanbad Jharia belt. And then I lived in a steel city 13 kilometers from one of India's largest steel plant. So that's my sort of other background in terms of I came from the belly of the beast.
So I have enough questions to pepper Shweta for at least an hour and a half or 2 hours, but we'll shorten those. But we'll use the chat. So if you have a question for her as this moves ahead, just put your name in the chat, and I will go down the list and call on everybody. Better than me restating what your questions are. It's better for everybody if you do it yourselves. The chat will help us from talking on top of each other. So I don't understand, though. Here you are, a college student, and I venture to say few of your colleagues decided that they were going to be able to change the world. Why did you decide that? And especially getting into the grimy underworld of narcotics and criminality and the prison system. I don't understand what moved you into that.
Well, there's another story to this, and I'm happy. I love to tell stories, so I'm happy to tell that story too. So when I graduated, I started working in a sort of a non-profit that dealt with the legal system. And one arm of that non-profit looked at People's Tribunal on Environment and Human Rights. And it was basically, so my job was basically to put together a tribunal of experts, sometimes and most times, led by a retired judge. And we would investigate complaints from communities where there are complaints of pollution or human rights violations by corporations. So, this was sort of like still that somewhat area of looking at human rights and law and going back to criminology and whatever background I had. What the interesting part was, and probably that was the turning point in my life, was that I think a couple of months into my job, and I was given the job to provide logistical support to the Bhopal gas survivors. I was based out of Bombay at that time in Mumbai. And the Bhopal gas survivors, these are the survivors of the 1984 Bhopal gas tragedy, were what is called the worst industrial disaster known to mankind. This is year 2002. And so it's already been about almost 20 years to the fight. And they had been doing a lot of demonstrations and actions outside the corporate headquarters of Dow Chemicals, which was the new owner of Union Carbide. And Dow Chemicals was headquartered in Bombay. So whenever the survivors would visit Bombay, my job was to provide them support, logistical support, facilitate media support, or any kind of assistance that they would require in setting up or in organizing themselves. And then also looking at how city and people in Bombay could extend their solidarity. So we do a lot of awareness events. So my first ever sort of responsibility as an organizer was to provide support to a group of Bhopali women. And when they came to Bombay, I got to spend a lot of time with them. And I had like really fascinating, I mean, that was really an eye-opening moment for me, because hearing the stories firsthand, hearing stories of women who had lost almost everything, their entire family members, their own health, and still 18 years, 20 years later, they were fighting. And they were not fighting just for themselves, they were fighting for a future that would be better and more just and would be with more dignity. I would give everybody more dignity, was something very, very inspiring. And I think that was it. And that's when I decided that I should continue and provide support and solidarity to environmental justice movements, starting from Bhopal. I became a volunteer for Bhopal. I'm still a volunteer for the Bhopal survivors and their movement, and contributing in whatever way I could, because I felt I was far more privileged than the folks over there, and I should use this privilege in a manner that makes sense in a bigger picture, in a larger way. So that was it.
So, but how do you make a living in this field? I mean, all well and good to be dedicated to the betterment of humanity, but everybody on the call has got to find a way to live integrated with the current economic structure and figure out how they can have a job and try to integrate their ideals within that job. How did that impact on your decision making?
To be honest, not much. I mean, no, I don't think it. Okay, I'm really, I'm just thinking how to respond to this question, but never gone hungry. Okay, so the other way to define is that what is your aspiration? I mean, if you want to make millions, of course, that's not going to happen. You know, if you want to own like 15 different cars, and I mean, that's a different lifestyle, and that's a different aspiration that we have. But I mean, I don't think that this job does not pay. I mean, it's a myth that it does not pay well. It pays well. And more importantly, we have a network, a support system, a community. We have a, I think that it's a much more satisfying, fulfilling space that you're in, and money is not the only metrics to define, success. I have never gone hungry, as I said, and I don't think that anybody should worry about that. I think we have a pretty, we have a pretty good life, I would say, and it's not just about money. It's just friends that we have. It's the network that we have. Anytime. I mean, it's a very different kind of a community, because we have friends who are standing by us throughout, and we have never felt alone, or never felt that this is sort of a tight spot where we have to change careers. You know, I don't know. I mean, I'm probably getting, I would now, if I continue to talk, I'll get a little philosophical. So I'm just going to stop here. But I can rest assure everybody that, money will not be a problem. It's just that we also have to define our aspirations, and we are covered.
I'm still waiting for the chats to come up, but what usually happens is that we'll go 40 minutes and then the chats will come up and it'll get real exciting at the end.
I just want to flag this. I have a direct message and I have a question. So maybe, Peter, after your question, I can address this question also.
Oh, please do. I don't, Mohammed, I don't see that on here.
Oh, no, I just got this. I got this one directly to me. It's not to the this
thing.
Oh,
not the group.
Not the group.
Yeah, please direct it to Hola. We're all not going to see it. But, go ahead.
It's a question from Donald, and his question is: India has many civil society organizations. Describe development of groups related to environmental justice. Well, so there are, I would say, and in my experience has been for the last 20 years with pollution impacted communities around India. And I would say that in every industrial hotspot, there is some kind of environmental justice related fight that is going on. It could be a very, very small scale, or it could be a very big scale. Some of the large scale national or even global movements, environmental justice movements from India, of course, there's been Bhopal, the survivors movement, or we have also heard about the Narmada Dam and the sort of social environmental justice sort of agitation against the Sardar Sarovar project and the Narmada Dam project, which led to displacement of many, many indigenous tribes and communities along its course. So these are two sort of the iconic EJ social justice movements that we have seen in India. But as I said, in my experience, in almost every pollution impacted community, there is a social movement, there is a strife, there is there is organizing that's going on. And the one of the common similarities that we have seen in all the environmental justice movements in India, big or small, is the commonality of the demands, which is clean air, clean water, good health, and basically a life with justice and dignity. I think that's been an unifying, uniting factor across India. And that also has provided opportunity for solidarities across communities.
So one of the big issues here, as you know, in the US is reaching from the ivory tower, if you will, academic settings and often middle-class background, to minority communities, low income and national minority communities. And I know you have the same issues in India. That community we visited and just west of the Bhopal plant was a migrant small area. How with your advocacy, how do you overcome the kind of distrust, et cetera, in those communities? And what has been your experience in the various areas?
So I think, okay, just a little bit of a step back in terms of like so I started with the Bhopal movement and as a volunteer there, and then eventually moved on and moved my base from Bombay to Chennai in South India to start a program called Community Environmental Monitoring. And this was in 2003. And the idea of the program was to work with pollution impacted communities and building their capacities to communicate the problems of pollution and health impacts in a manner that could not be refuted by agencies without investigation. Okay, I'm like, this is a very complicated sentence that I just said, but basically, and there is another thing that we see normally with nonprofits and sometimes with environmental organizations with all their best interests at heart, they still sort of become the voices and representatives of other communities. And that's something we didn't want to do in this program. And we wanted to be the grassroots support organization, grassroots support group that helps community strengthen its voices and speak for itself rather than we speak for the community. And the idea was, and it was a little bit of a risk because, sometimes, community does not want the chemical factory to shut overnight. There are a lot of nuances in those conversations on the ground. And I could come and sort of skew the conversation saying, shut this factory or shut this thing. But there is a process, and that process has to play its part. So the idea was that definitely communities they had the lived experience of pollution, but most of these communities, like in the US, are industrial townships in India are in marginalized areas. They're socio-economically, politically marginalized communities. So these are, out of sight from the policymakers. So the community that I worked for decade, for at least more than a decade, was in Kadalur, which is 200 kilometers south of Chennai. Chennai is the capital city in Tamil Nadu. And this was a small coastal village, which had about 30 chemical industries and villages sort of sandwiched in between industries, and people complaining about toxic pollution, but the regulatory agencies dismissing them just by saying that these are people who are disgruntled and they didn't get jobs from the factory, so they're making up these lies. So, this was not just a problem of pollution that we were tackling. This was a problem of trust and dignity also that people were facing, that they were not being believed for their experiences. So our sort of framework was to provide support to these communities and use science, but and technology, but low cost or no cost, because communities cannot afford very expensive technology, but mostly use our bodies as monitors. So what we see, what we smell, what we hear, what we feel, document that in form of evidence in a manner that, when you see that evidence, regulatory agencies have to take notice. And just to give you a simple example, in this community in Cuddalore, there are pesticides, petrochemicals, plastics, bulk drugs, chemicals industries. Like these are 30 different odd industries stretched over 8-kilometer area. And there are different kind of smells that people will talk about, like toxic smells, noxious smells. And when you talk to people, they will tell you at different times of the day, wind will bring smells from different directions. So people would describe smells of nail paint or rotten cabbage or rotten eggs and burnt rice. I mean, they were. So when we started actually documenting the smells, we documented about 36 different kind of odors that people had documented. And I mean, it's 10th grade science, chemistry, that tells you that chemicals have odors. And if people are reporting odors in an area which has chemical plants, the most logical thought would be these odors are coming from the plants, these chemicals are leaking from the plants. But there was no way to tell because nobody would investigate that. And people would, and regulatory agencies would dismiss these complaints as odor nuisance. So we started documenting these odors in a systematic manner. And we did that exercise for 2.5 months. And then we were very proud of ourselves because we had like this wealth of data. And then interestingly, we were introduced to some German scientists, occupational health specialists, and we thought that we would seek their advice on this project, which we thought was like the first of its kind in the world. And to our surprise, we learned when we met those scientists that in Germany, odor monitoring by nose, human nose, is a very common sort of scientific practice. So what we thought we were discovering was already discovered somewhere else, but it was an interesting exercise. So taking that exercise to the next level, we again, and this is an example of global solidarity, we collaborated with the Bucket Brigade in the US, which some of you or a lot of you would be aware of. Also the famous Erin Brockovich was also associated with the Bucket Brigade. But fence line communities in refinery areas in Louisiana had used the bucket to trap the volatile organic compounds in the air and get it analyzed in the labs to sort of see what kind of toxic cocktail they were breathing. So we borrowed that science and we built our own buckets in India, and villagers went around taking samples in the bucket. And for the first time in the history of environmental research and science in India, villagers in a remote village, a coastal village in India, did analysis for volatile organic compounds, which top scientists in India had also not done in residential neighborhood. And this was in 2004. And as we learned from the process, there are two things that came out very clearly. The best way to provide solidarity and community support is to demystify science. It's and sort of use citizen science and build on that awareness and organize and help organize communities and then hold the regulatory agencies accountable. Because when we started using this data that we had collected in the most scientific manner as evidence, the whole narrative of argument changed. Earlier the complaints were always about regulatory agencies will come and say, today the pollution is high or low. It was in terms of adjectives. And when we started putting our data, we were giving them numbers. We're saying benzene was in this level. I mean, when we found the results from the bucket samples, it was shocking because we found 30 odd toxic chemicals, and out of them 13 were carcinogens, and some of the chemicals were like 20 to 30,000 times above safe limits as prescribed by US EPA, and India did not have standards for volatiles in the air. So, I mean, that's an example of using technical, scientific knowledge, but in a manner that is accessible by common people. You don't have to have a PhD degree to sort of understand that science. And it also translates some of the local knowledge into evidence. Like, when water is black in color, it is polluted. I mean, you would need scientists to come and tell you how to clean it up, not to tell you that it's polluted. right? So sort of changing that course of conversation among people using technology and knowledge, but making it more accessible and more available to people, I think was key. And I think to answer your question, Peter, I mean, in a long-winded way, that was the way to sort of gain the trust from the community and work collaboratively.
Unfortunately, Bucket Brigade is perhaps not as well known. Basically, it's a big plastic bag. You tell people to go out in their backyard, and when they smell something they're suspicious of, they just grab the air in the plastic bag and send it off to the laboratory. Now, I think still in California, and then they evaluate it. They do a G6 mass spec on it. Can't give you concentrations, but it tells you what's in there. All right, good. So Larissa, you want to ask your question?
Well, okay, just to sort of, I can see Larissa's question. So yeah, I mean, marginalized communities. Okay, what are those? Sorry, I can repeat it if you want.
Who are the marginalized communities, and are there any other factors in India other than socioeconomic status? Are there communities indigenous or have a different religious background?
So yeah, these are indigenous communities. I think socioeconomic status matters a lot and plays a significant role in defining how marginalized they are. Their political power, because a lot of their socioeconomic status also defines how much of political power they have. And then, of course, there are groups divided in terms, not just in terms of class, but also in terms of castes. So, you know, the groups that fall, or the communities that fall in the scheduled caste, category, and backward caste categories are further marginalized or further away from having influential say in decision making. So it's caste, class, and religion, and of course, and it depends on in geographies, because in mineral-rich areas you have mostly the indigenous communities, the Adivasis, who live in the forests and are directly impacted by decisions like opening up of mines and power plants in those areas, or any kind of extractive industries. Even within a city, the city is sort of designed in a manner that keeps the powerful and the upper caste communities at the center. And again, as you sort of move towards the margins of the city, where you will find the landfills or most of the factories and chemical plants, you will see the sort of that caste-based gentrification that you can see. Then you'll see more marginalized castes living in those areas. So that's sort of is the general sense that we have here.
You unfortunately overestimate the education system in high school and college in this country. Tell us what scheduled castes are. And, we've always heard about castes, but we don't quite understand how they interact culturally, et cetera. And economically.
I am not an expert in caste system, but just simple sort of way to describe is that there are 4 main categories. And I mean, I don't want to go into the details of it, but the most backward castes, and so for historically, a lot of the kind of jobs that you could hold were defined by your, in which caste did you fall, and the privilege that brings that caste. So if you are in an upper caste community, you have more access to education, you have more access to benefits, and as you sort of fall, if you fall in a lower caste community, then you are sort of more alienated from schemes, and most importantly, access to education, and even entry to certain places were barred earlier. And in our constitution, in order to sort of bring to bring about equality, the constitution sort of has defined certain castes as scheduled castes, sort of identifying that they were marginalized and they were discriminated against. And in order to sort of bring them together and recognize that discrimination and making sure that they are not further discriminated. But it's sort of like an affirmative action, a parallel to that in the US, but this is our system.
Thank you. Let me then go to how do you deal with the bureaucracy when working for environmental justice? What are the frustrations that you've faced when advocating against people in power? And has there been legal action taken against your groups or that sort of thing?
Well, I mean, it's always a challenge to work with bureaucracy because, especially in the EJ movement, because as I said, the one reason I think here the bureaucracy holds a lot of knowledge and power and does not let go of that and or share that power with the people as it should be, and that sort of power becomes a point of divide. And when I say we work in demystifying science, is making that information and power sort of shareable and accessible to as many people as possible. So that's not what regulatory agencies normally like, right? We face so the first thing that the dismissive attitude that we don't know enough about our air or water is very obvious. The relationship of people people versus bureaucracy has always been people see bureaucracy as or people in power as higher up. So there is not just respect. There is sometimes you feel like you are a second class citizens as compared to people in power. And we have seen that dynamics change when there is information that is accessible to people. And when people start realizing that regulatory agencies are there to serve people and not control them. And that's where the equation has changed. But in general, most of our experience from bureaucracy has been of being dismissive, and we just have to be at it to bring about a change. A lot of the changes have also happened because of legal cases that communities have filed and courts have given orders to regulatory agencies to follow the demands of the community. So, a lot of the changes in the in the short term, in the attitude of the bureaucrats have happened because of the court's intervention. And over a period of time, I think we are seeing now a different attitude where there are regulatory agencies and there are regulators who are getting more accessible to people and who are listening to people's problems and sort of trying to tackle them together. But that's very, very rare. Mostly it's of dismissive and you have to fight your way into those places. In terms of legal actions on us, there has been a defamation suit that has been going on some of us. It's like the slap cases that you have in US, where corporations try to entangle you into lawsuits or libel suits, and you fight them. And there's not much to they don't have much of case because all our work is well referenced and is based on factual material, but it's just a way to keep you engaged in and distracted from your main fight and keep you bothered for years to come. So we have that. There are sometimes occasional cases of intimidation and threats, not much, but I wouldn't deny that. Otherwise, most of the times it's the communities who are filing the cases against the regulatory agencies for and holding them accountable for their dereliction of duty or in terms of for against corporations for violations, environmental and human rights violations.
And the next one's a difficult one. How do you handle the politics within those communities, the disadvantaged communities that you're working in? Because clearly they don't all support your advocacy, et cetera.
Not at all. And yeah, that's absolutely true. And one of the biggest challenges that we faced, and again, going back to Kadlur, because I've spent so much time over there, and also these examples, these questions are sort of reflecting back to our journey over there. When we started working with the communities, our biggest sort of pushback that we got from the community was the workers who were employed in those factories. And it was almost like a divide between the workers who were also the residents of the communities but working in the factories, and people who were not employed in the factories. And I think the way to resolve that was to sort of reach out to the unions and the workers, explaining to them that the environmental work outside the factories in the communities are actually supporting their cause, because for communities, the workers are in the first line of fire. If the toxic levels of toxic chemicals outside the factories in people's homes were so high, imagine what the exposure in the factories would be. And it took us a while, and it took us a few years to sort of get that message across. And we started work in Kadlur in 2003, and it was in 2009 when the first strike called by the union in the factories in Kadlur, for the first time, that strike was called on grounds of environmental violations committed by industries in Kadlur. So, it took us 6 years to sort of get that message across. And it was a tough, conversation to have, but it did happen. And we had the workers on the side of the people who were struggling, against the factories. And that's why I also want to reflect on this fact that the communities, impacted communities, have nuanced positions. So it's not black and white that you find a company polluting and or something that you are not happy with and it just shuts down overnight. It doesn't happen like that. There are discussions, negotiations, conversations that happen, and our jobs is sort of to start those conversations and let the community decide what's best for them. And there was one thing that throughout in wherever we have worked and we have assisted communities, we have seen that the non-negotiable point is that if there is an illegal violation that the corporations are engaged in, that's not acceptable. So they will, irrespective of however number of jobs that they provide, the villagers felt obliged, or residents felt obliged, to hold legal violations accountable, of the corporations or industries that they were sharing their space with.
And the next is, have you found a changing role for women in the environmental movement or in politics in general?
Absolutely. And this is again been our experience that wherever women have taken leadership role in fights, in movements, the nature and the growth of those movements have been very, very different. And I don't want to sound biased, but I just feel that, and spending so much time with women's groups in and especially again in central India, where there are mining projects and women are at the forefront opposing those coal mines, the nature of conversation is totally different. It is more instinctive. It is more towards protecting the health and the community's health and children's health and thinking about the future. And I don't know, I don't think I'm putting it right, but I'm just saying it that, and I'll give an example of this. It's less transactional. Not that saying that men think in that way, and just to give one example, so there is this mine in central India, a coal mine, and a community, an indigenous community that lives their village is the last remaining village which has not been taken over, because they have been putting up a resistance by the mining company. So they're surrounded by mines on all four sides, and there is a strip of road that sort of connects this village to the nearest town. So when you start driving from the town into this village, for a very long time, on this road on either sides, you will see just coal mines. So that's the setting. And the coal mine in their vicinity was coming up for expansion, and women were strategizing, and so were the men. The whole village was strategizing as to how to oppose it. But when we shared about the proposal that was up for consideration by the government for mines expansion, the first thought that came from the male leadership was, oh, double mine means double compensation. And the first thought that came from the women's leadership was, double mine means double dust, and that means double trouble. So I'm just giving you a very, very probably simplistic example of the thinking. And I mean, at the end of the day, both the leaderships were together to sort of plan how to oppose. But this is the way sort of they were tackling the issue. So, you know, I feel that women's leadership is far more instinctive and, you know, much more rooted on in the community wherever I've seen that.
A couple of practical questions. What advice would you give a PhD student who is hoping to pursue a career in environmental justice, global health, and climate change? Are there any skills or experience that you believe are essential to making a difference in this field?
Okay. I just feel that okay. I have another example of this. So I think that's the best. I don't think we need any particular special skills to get into this space. I think the beauty of this space is that whatever we feel, whatever skills we have, and whatever aspect that we feel that we can use, or whichever way we can use those special skills to contribute in the movement, the movement sort of welcomes that. So it's not like specifically you have to be trained in a particular subject, or you have to be a doctor or a nurse or a social work student to be an active member or organizer in the environmental justice movement. There's space for artists, there's space for musicians, there's space for filmmakers, there's space for people who have skills to cook well, because everybody needs to be fed. So I think, you know, this is a space, in fact, it's an interesting sort of a space where everybody is welcome, and you need to be passionate about what you're doing, and you need to do that work with integrity and honesty. I mean, that's like my big sort of picture reaction to this. Specifically, if you're looking at pursuing a PhD, I think what is important, and not just in terms of like responding to your PhD question, but in any form of research, if that research becomes accessible and usable for community, I mean, that's where I have seen most of the difference. So, you know, research not for the sake of research, but research that actually people can understand, use, and use that to sort of advance their demands for justice, demands for cleaner air, cleaner water, better health, better facilities, whatever it is. In any way, if that story is told, or that story or that fight is assisted, would be a good research, in my opinion. I know all the professors and teaching staff might disagree with me, but that's where I have seen most benefit and most use of good knowledge in terms of assisting and supporting people's movements.
There's a specific question to pursue the economic issues, but it's within the US context of graduating from a professional school with a great deal of debt because of the private nature of education, higher education in the US, et cetera. So this limits the ability to do some of the things you were talking about. And the questions are, what is the career path? You know, you said that there are jobs. Perhaps this segues in just for a moment into there you are working on these issues in small communities in India, in different areas of India. How did that get, how did you segue into the global scene? What is the global scene? And there's also a question about the involvement of healthcare people in that process. So I threw all the questions in at the end. So Pick what you like.
Okay. So I think a couple of things that I would highly recommend, which I sort of also encourage my younger colleagues over here, is whenever you get an opportunity to travel, and especially to, I mean, if your interest is on EJ movements and social movements, do travel, do connect with communities anywhere. I mean, you don't have to particularly come to India to do that. I mean, there are plenty of social justice, environmental justice, racial justice movements in the US. The idea is to sort of experience the diversity and learn from that process. I think that is very important. Even if you decide, I mean, even if you think that you are pursuing a career which has no connection with anything that happens on the ground, that's not true. I think these learnings sort of influence our decisions in whichever profession we are in, and wherever we are. That's one sort of advice that I would give. The second thing is that there are always opportunities for lending solidarities. We always have, requests, and there's so many movements that we are all aware of, and there are so many crises that movements are fighting on a daily basis. There's always an opportunity for solidarity. I think solidarity makes those efforts, those fights stronger, and there is a need right now for local, regional, national, and global solidarity. So one of the reasons why, how I have seen my sort of career moving is also connecting Indian communities and working in communities that I was working in with communities in Southeast Asia, in US, in South Africa, sort of building on that global solidarity. The Bhopal movement itself is, a lot of it is global solidarity that people in Bhopal get. And it's not just for the people in Bhopal. It's again, as I said, all these movements have a common demand, which is your and mine common demand too: clean air, clean water, right to healthy life. And so in that sense, the demands and our experiences and our struggles are common. And how do we make this a collective strength rather than these small fights here and there? So solidarity matters a lot. And it's important to sort of lend and seek solidarity, because that helps us stay connected as a global community. And I mean, one of the pieces of work in the last 5 to 6 years, 7 years now, that I sort of segued into in the EJ movement was to sort of highlight the health narrative of all, in all these pollution fights by the pollution impacted communities. We saw that in all these conversations that we were having, there was judiciary involved, there were regulatory agencies involved, there were engineers involved, because they will have all these projects. But the medical fraternity, the health community was not involved. It was community's own lived experience of health impacts, but it was not like doctors were like at the forefront supporting those communities. And that was a lacuna, that was a gap that we realized. And so we started sort of in 2014, around 2014, we started mobilizing the health folks to lend solidarity to communities, to sort of investigate communities' complaints of health impacts, and provide evidence and use that information, because health professionals are also very trusted messengers. In India, we have particularly seen that when doctor advises his or her patient, the patients sort of take it very, very seriously. So that power, using that power to sort of reflect upon the impacts on the communities and advocate for policies that make sense for everyone. So we started sort of working with the public health and the medical fraternity. And one of the examples of a very strong how the project has evolved and a strong action is a program in India called Doctors for Clean Air, where we have doctors mobilized from small geographies and small cities and towns who are talking about clean air and action on clean air, not just to their patients and not to the local communities, but also to the policymakers, also to the mayors in the city, or the city administrators, advocating for better policies, be it transportation, or be it no further fossil fuel industries, in terms of for cleaning up the air. So that's where I sort of shifted gear from just providing the technical support to communities to sort of bring in this particular influential group into the mix of conversation. And we have seen the conversation evolve since. And one of our campaigns in India has been to bring in health impact assessments along with the environment. So we have environmental impact assessments for projects, but we don't have health impact assessments. And as we are seeing that the health is, health is impacted way more and never factored into decision making, we want to change that conversation, and we want to move the agencies to adopt health impact assessments for any industries, toxic industries, particularly going forward. And we're gaining quite a bit of traction so far. Not there yet, but we will get there yet sometime.
So just to tell you, that's a great segue into the situation in Chicago and the role of the School of Public Health here with respect to a particular polluting plant that's moving from a rich white community on the north side to a poor minority community on the south side. And the school and the dean have weighed in on this quite specifically with respect to the questions of environmental racism and demanding that sort of health assessment, impact assessment you're speaking of. So I wanted to thank you very much for joining us. Anybody with a last minute question? We got a minute. You can quick.
Hi, Shweta. So I had a question. So going back to the woman-led movements, do you see that being more done in southern India rather than other areas in India? Just for example, I was somewhere in Kerala and I was at a tea field and they talked about how the women went on strike there and shut down the whole operations. And it was a large tea operation, and so it kind of crippled their thing. And so I was just wondering, is that more, have you seen that all over the country, or is it more in certain regions?
All over the country. I think what you're talking about is it was also Kerala has government, or for a very long time has a history of the communist government in power, and so the unions are really powerful. So this was the women's wing of the union that sort of called for that strike and for better wages. So I mean, that's a struggle that's been there everywhere in terms of fair wages for women and women workers. But in general, what I have seen is women around the country are sort of fearless and on the forefront, fighting with their all might. Yeah.
So thank you again. Just as a final departing advertisement, Shweta has a TED Talk from about a month or so ago, or 2 months ago, and I heartily recommend it to you. This will be recorded and we'll get you a copy of it, and no false modesty here, because we want this circulated near and far. So we thank you very much. And thanks everybody for coming, even though it's a little bit of an odd hour. Maria, we have to re-secure the noon hour for these things. So,
Dr. Ors, if I could just add, if people wanted to learn more about your organization, Healthcare Without Harm, or had a question for you as well, where should they go?
I can, there is Healthcare Without Harm's website. There is healthcareclimateaction.org, which I can just mention over here. And then I can also leave my email address, my Healthcare Without Harm email address, if people want to get in touch with. And then you have Dr. Peter Orris.
So, and we can use support for our green team. So anybody interested in getting into the nitty gritty of the local level and real practical stuff, the green team at the medical center can always use support. So just give us a buzz. Great. So did you put health? You did, wonderful. So anybody who didn't get their questions answered or had questions they didn't ask, we're going to lean on Shweta and stimulate her organizing excitement by sending them directly to her. So thank you, madam. We appreciate your time, and get a good night's sleep. And we're going to go on for the rest of the day here.
Thank you. Thank you, everyone. Bye.
Thank you.
Bye.
Bye. Thanks so much.